right, so we have Jack here who has some left-sided neck pain. We determined it is a herniation of the C6 and C7 and that he has radiculopathy. So those are the indications. And then the contraindications include just hardware in the spine, acute sprains, acute inflammation, any like joint instability, and then are also classic kind of contraindications that include cancer, DVT, any like osteoporosis wouldn't be good either. So go ahead and talk to Jack here. How's it going, Jack? So we're gonna do some traction today to kind of alleviate how much pain is radiating down your left side here. And then kind of decompresses that nerve that's just getting compressed on your spine. If that's okay with you and all. So.
Yeah.
Okay. So first thing I just want to ask you: are there any internal fixations in your spine, or any hardwares?
No.
Any like cancer, any DVT that you've had in the past?
No.
No fractures. And then one important thing too is when we do this, we don't want the pain to continue down to the arm. We want it kind of more coming from your spine, so more centralized what that means. Does that make sense?
So you want the pain to just
Be,
stay on your
yeah.
neck.
So if the pain, so it's radiating down, but if it comes back up, we want that. If it keeps coming down, we don't want that during that contraction.
Yeah. Okay.
Now, we can go get you set up then. Go ahead and put your head back into this attachment. And then we're going to keep the holster just right on the back of the ear bone, if you feel that.
Yeah.
Yeah, we're going to keep it right there. I'm just going to strap this around. And
we're going to do some traction. I'm really putting it back for the
non-snug.
Great. I believe that traction will help the modality that will help you.
No, that's good.
Get into that one. I got some relevant kind of red flags that I just want to cover with you, make sure you don't have. Do you have any acute inflammation or strain or stents now? Great. So traction didn't go up, right? Okay, perfect. Now, when you kind of pull on it, you get this thing we call peripheralization.
Alright, so we have this here. And it just says, as it says here, we're going to pump to pump this up. We have the incline at the highest level just because this head's a little larger. So we're going to go ahead and pump this up to about 7 to 10 pounds initially, and then we'll get up to 20 pounds. And then we'll keep this here for about 10 minutes. We don't want to do intermittent, but want to keep it static since he has a disc herniation. So I'm going to go ahead and pump that up. Let me know if it's too much, right? Good?
10, 15 minutes, 30 pounds.
Does that feel all right?
Yep.
Oh, looks like it. Okay, so that's just about at 20. And we're going to, so I'll leave you here for about 10 minutes. I'm going to leave you this bell. If for some reason it becomes painful or that pain starts to go down your arm again, ring the bell, or you can actually look on here yourself and it has a release. So you just twist it to the left.
Oh, okay.
So I can give you this. You see that release?
Cool, yeah.
Okay. So if there's any complications, you just either release it or just ring the bell and I can do it for you.
Okay.
Cool?
Cool.
Any questions?
No.
Awesome.
Good.
All right. And now the 10 minutes is up. We can go ahead and release this. How'd that feel?
Oh, that feels way better.
Okay. There's some redness here, but there's no irritation either, so it should be okay. Feeling all right now?
Yeah.
Any pain? Now, a lot of times the pain will return back as the neck kind of decompresses.
Yeah, I mean, I felt that too, like it was coming up, like you said.
Yeah. So just kind of ease back into things. Try to stay horizontal or lay down on your back for a while.
Okay.
Should be okay.
Cool.
Cool. Any other questions? Sweet. So here's the mechanical traction machine and the setup here. We have the same time as we did for the pneumatic device for 10 minutes. We're going to increase the the weight to 20 pounds. And then we have a static hold time and not intermittent since he has a disc herniation. And then we have the flexion degree to 20 just because we want to help that range of motion out for his cervical flexion.